Hello, this video was developed to demonstrate clinical bag and equipment technique. The company issued bag may be a shoulder strap or rolling bag, depending on the physical limitations of the staff and requirements of the clinical role. A bag may be of different styles, but all bags must be cared for appropriately in your vehicle and in the patient's residence. To transport your clinical bag or laptop bag in your vehicle, the bag should be placed on an impervious barrier. That's something that will not let fluids pass through, such as a chucks or drape. It should not be placed directly on the interior upholstery or carpet of your vehicle.
So when I arrive and the family directs me to sit down and put my bag down on the sofa, can I do that?
If your bag is hand carried or an over-the-shoulder bag, it's to be placed on an impervious barrier on a clean, dry surface, preferably a hard, non-porous surface, or it may be hung from a non-upholstered chair or a doorknob. If it is a rolling bag, the wheels are considered dirty and should remain on the floor of the patient's home. Keep in mind that the outside of the bag is considered contaminated or dirty, and the inside is considered clean. Therefore, hand hygiene must be performed prior to entering the clean inside compartments of the bag. Ensure that all clean compartments not being used are closed.
Is it okay for me to have hand sanitizer inside of my scrub pocket or hanging outside of my bag?
Sure, and one of the outside pockets may be used for hand hygiene supplies such as soap, paper towels, sanitizer, and cleaning wipes for cleaning your equipment. Remember, any non-disposable item removed from the bag, including the disinfecting wipe canister, must be cleaned prior to returning it to the bag. A barrier should always be between your clinical bag and surfaces in the patient's home.
Would paper towels or a newspaper be good enough?
Paper towels or newspapers may not be used, as they are not impervious to moisture. A chucks would be optimum. Your barrier should be used only once and discarded in the patient's residence. When removing patient supplies from the bag, they should be placed on a clean, single-use barrier and not directly on any surface in the patient's home. For single-use items, discard after use. For multi-use items, such as your stethoscope, blood pressure cuff, place item after use on separate single-use barrier that is designated for dirty or contaminated items. Clean or disinfect items with organizational approved cleaning wipes prior to replacing the items into the bag. Maintenance of bags. On a weekly basis or when visibly soiled, staff member will clean or disinfect exterior with organizational approved cleaning wipes. If a bag is worn, ripped, or otherwise damaged, contact Training and Development or IT as appropriate, and it may be replaced at their discretion. Special concerns. If the staff member has serious concerns about the cleanliness of the patient's environment, the bag should not be taken into the home or residence. Serious concerns include if the residence is infested with insects, including bed bugs or other vermin, if the patient is known to have a contagious illness or multi-drug resistant organism such as VRE, MRSA, or C. diff. Supplies bought into these residences must remain in the residence. Take into the residence only the supplies needed for that visit. Place items in a disposable bag to take supplies into the residence and discard inside the residence. Electronic devices for documentation such as laptops or tablets should be carried in the hand, not in a bag in these locations. Place on a disposable barrier on a hard surface and the exterior cleaned with approved wipes when taken from the home or residence and before placement in the staff member's vehicle.